Welcome to the New Gastroenterologist, Private Practice Perspectives. I am Raja Taunk. I'm from Annapolis, Maryland.
And I'm Dr. Lisa Mathew. I'm from South Denver Gastroenterology.
And we're here to share some of our thoughts and insights on private practice and building your practice. How long have you been in practice, Lisa?
So I am entering into my 11th year of practice. Our group is independent private practice. We're about a 27 physician group, so about mid-moderate size group. We have 4 clinics and 3 ASC surgical centers. And as I said, I've been with the group actually since I completed my fellowship training. Raja, what's your practice like?
So I think my story is similar to your arc. I'm in my first job since finishing fellowship in 2014, so 10, 11 years. We are a smaller practice. We are 10 docs with some APPs, 1 large surgical center.
Yeah, so we're here today to talk about referrals and how does one build a referral base. And so when I was starting out in practice, it became apparent that nobody really knew me and I didn't know anyone else. And so I think one of the first challenges was really building a network, both of providers who knew me and would be able to call me and refer patients directly, as well as actually to build up my referral network. Because as is true in most areas of life, I think your net worth is your network. And so increasingly, patients really would turn to me for referrals to, say, local surgeons. And so I think a big part early on in my practice was identifying who are those trusted individuals in the community that I wanted to direct my patients towards. And sort of organically with time, that also became then the community that was referring to me.
Similarly, I think I came into an established practice where we had some retiring physicians, and so some of those legacy practices will fall sometimes to us. But importantly, you do have to get your name out there. Initially, we took a lot of call in the hospital, and so that really gets your name out there with the other hospitalists. And putting in actually longer hours, willing to do that little extra mile, a little extra homework, it breeds a lot of trust and willingness to refer to you. And then secondly, I think one of the things that helped me build my practice is I have a particular interest in inflammatory bowel disease. And I would encourage everybody in GI, we treat everything, but if you have a particular interest, to really dive deep into it, because then that patient population will follow you. And within your community, I'm now known as one of the docs who treats a lot of inflammatory bowel disease.
I think being a good doctor speaks for itself.
Yeah.
And when you provide excellent care, over time, that becomes known and appreciated in your community. And so it sounds like that served you very well. And I can see, aspects of that in my own strategies through my career. I think, some other things that I would reflect on are the value and importance of being aware of the system in which you're working. So making it really easy for people to refer to you is sometimes being aware of the system by which they are referring. So for example, if your local PCPs are all using one EMR, and there's a way for your EMR to integrate with that can be very valuable and sort of reduce some of those barriers to having those referrals sent to you. And just as importantly, I think the follow-up piece is essential. So making sure that, when you have provided that excellent care, when you've done that great colonoscopy, making sure that information gets back into the hands of the referring doctor is really a critical piece.
I think, we're both independent, gastroenterology practices, and so we don't have the luxury to rely on inherent referral patterns within a system. And so I think to your point, Lisa, a good doctor speaks for themselves, and having the ability to communicate that out via systems has been very important. When we will talk to our primary care colleagues and say, hey, is there anything you need from us? Are our notes getting to you? Make sure that the communication is going forward.
The last little pearl that I would leave with is always get a cell phone. When you're interacting with somebody in your community who you want to, increase or improve a relationship, having that access point is essential. Don't abuse it, but having that ability to really knock down the barriers of the phone trees, which are just difficult to work through. Give them your cell phone, get their cell phone, knock out the middleman, just have that dialogue with your referring providers so that you can really deliver on what they need and that they have very easy access to you.
I think that's a great point. And also building upon that, I think keeping curiosity and knowing that you're not disturbing them as much as they're not disturbing you. If you need to ask someone a diabetes question or a cardiac question, you know, we all came from teaching institutions, someone taught us, and we don't have to stop learning or being taught just because now we're attendings. You know, a cardiologist can teach me about anticoagulants through a text message, and now I've built that relationship with them a little bit further, and vice versa. They can ask, you know, how long do I need to stop this anticoagulant after a polypectomy? So I think staying curious and helps you stay engaged, and staying engaged, I think, really builds that that community with your other referring physicians.
Couldn't agree more. Yeah. Well said. Thank you, Raja. I'm glad we were able to do this.
Lisa, I'm glad we were able to talk.